A patient walks in with fever, dry cough, and a story that seems harmless until you hear about the parrot perched in their living room, and suddenly a zoonosis snaps into focus as psittacosis caused by Chlamydia psittaci, an obligate intracellular organism that survives by hijacking host energy, transmitted through inhalation of aerosolized dried bird droppings or respiratory secretions, especially from parrots, parakeets, and other psittacine birds, setting up infection in alveolar macrophages where it evades destruction and spreads hematogenously. The incubation period stretches from 1 to 2 weeks, after which the illness declares itself with high fever, severe headache, and a non-productive cough that can progress to atypical pneumonia, often accompanied by relative bradycardia, a clue that echoes other intracellular infections. Chest imaging may show patchy interstitial infiltrates that do not match the severity of systemic symptoms, and laboratory findings can reveal elevated liver enzymes, linking pulmonary infection to hepatic involvement through systemic spread. Without recognition, complications can extend to endocarditis, myocarditis, and even encephalitis, reflecting the organism's ability to disseminate beyond the lungs. Diagnosis relies on clinical suspicion supported by serology or nucleic acid testing, since routine cultures are difficult and hazardous. Treatment hinges on tetracyclines, with doxycycline as first line, penetrating intracellularly to inhibit protein synthesis, while macrolides serve as alternatives in special populations, yet delayed therapy risks prolonged illness and relapse. This infection stands as a classic example of zoonotic transmission, where occupational exposure in bird handlers, pet shop workers, and poultry processors raises risk, but even casual pet ownership can suffice. Prevention centers on controlling bird infection, proper cage hygiene, and protective measures when handling birds or cleaning droppings, reducing aerosolization that seeds human disease. The organism's life cycle mirrors other chlamydial species, alternating between infectious elementary bodies and replicative reticulate bodies, a detail that explains both its intracellular dependence and antibiotic susceptibility profile. In exam settings, the triad of bird exposure, atypical pneumonia, and systemic features should immediately point to this diagnosis, distinguishing it from other causes like mycoplasma or Legionella by its zoonotic link and hepatic clues. Recognize the pattern, ask about birds, start the right therapy early, and carry this association forward, because one overlooked parrot can rewrite an entire clinical picture, so commit it to memory and use it when it counts.